85% said that they had used a hospital in the past 2 years. 73% of those respondents had used Share Medical Center, and other hospitals listed included some of the regional hospitals in Northwest Oklahoma and the Oklahoma City area. The furthest one was Mayo Clinic in Minnesota. As compared to the other hospitals that OSU has done the community needs assessment for, Share Medical Center utilization was about 13% higher than all of the other hospitals that they work with. So that was a positive reflection for us. 23 out of the 30 responders who used hospitals other than Share Medical Center stated that either it was their physician that recommended that they seek care outside of Share Medical Center, or it was a specialty that we did not provide. Of the 85, only 5 stated that there were quality concerns as their reasons for not choosing Share Medical Center. 88% of the responders stated that they were satisfied with the services they received at Share, which is about 3% higher on average than the other hospitals that participated with OSU. The number one reason for the patient satisfaction was they identified Share as having friendly and caring staff members, and conversely, unfriendly or unprofessional staff was listed as the number one reason for dissatisfaction, and this was noted by the 5 responders. Let me go on. I want to talk about providers here in a second, but one of the things that Mrs. Brooks discussed as a surprising finding was that in general the group felt that there was good quality of care at Share and staff at Share, but they were really surprised that nobody mentioned what? Our billing. I've been here before. We've talked about it before. But we were really surprised that out of 85 people that nobody brought up the challenges that we've had in the past with our billing. So I think it's getting better. I think maybe we're turning the corner, and hopefully some of the things that have come out of groups like yours that have been honest enough with me to either come up after the meetings or give me a call or email me, hopefully some of those things are paying off and we're able to resolve those. One of the latest things that we've done, we kept hearing people were getting the phone call from our, I hate to say, what's another word for collections? Collections. It's not true. You haven't been sent to collections. We have outsourced our collections to an agency. Anyway, people were fired up that they would get a phone call before they actually got a bill in the mail, and that was not what we intended to happen. So hopefully we've got that process taken care of. 30 days should be passing from the discharge of your encounter to the time that is allowed then for a phone call to happen. So hopefully, if you're still experiencing that, please do let us know, because we've worked on that. And if you're still experiencing some billing problems, please do see us afterwards, because we have been working hard on trying to do a better job of that, because we get you in the door, we surely don't want to make you mad when it comes to that process. So some other things going on. Providers in the ER. So out of community feedback, I had a provider in the ER that people didn't like. So we have changed that. We have currently, right now, we have Dr. Koch and Dr. Reiheld that are coming to cover a couple weekends a month at Share in the emergency room. Dr. Koch was there last weekend, and I think it was 2 weekends ago, and we have gotten really good feedback that everybody really liked him. And another one that we're going to bring on soon is Emily Bays. Emily's a PA, and she's been working in emergency rooms, and she gave me a call, and just about at the right time that we were looking. So we'll be bringing Emily on to work a weekend in the emergency room. So we're excited to have her. One of the other things, May 21st. After May 21st, it will be required that providers that are needing or that are conducting DOT physicals will have to be certified. And Lindsay Pruitt is taking her certification to be able to do the DOT physical. So if there's anybody out there of you that has to have employees go through the DOT physicals, just a reminder that we do provide those. Okay, so what questions do you guys have for me?
Better have some really good doctors and PAs working this weekend.
I know.
You know what's on.
Yes, it's Snake Hunt weekend. We ordered CroFab for the snake bites, and actually Dr. Ryheld will be here this weekend to cover that shift. Yeah. Hopefully we won't have. Yes.
As far as your occupational therapy now is involved with the nursing home?
Yes.
Is that Medicare supported, I suppose?
If the patient qualifies for the swing bed or for the skilled services, yes.
So that'd be swing bed only?
Yes, swing, skilled, yes, yeah. And let me mention too, Mac, I'm glad you brought that up. We've had a real need for that program over there because our staff has been pulled in so many different directions. Now that we've got that program in place, it will allow us to focus more on a restorative program, and that's probably more what you are talking about in that situation. We're going to be able to focus our resources that we have on the restorative program, which is basically helping residents with their activities of daily living, keeping them active and strong and able to continue to do as much as they can do. Because we all know if you don't use it, you lose it. If you're just sat in the chair, if you just lay in the bed, you are going to lose your ability to function. So that's what our plans are, is to beef up our restorative program to be able to offer more services for our residents that are in just a regular nursing home status.
The second part of that question,
yes.
If Medicare does not cover it, can that be on a cash payment basis?
Yes, absolutely. Sure. The occupational speech therapy, any of that, could a person, if they weren't qualifying through their insurance or through Medicare, it could be on a pay basis.
It seems like that was a real problem over at the hospital. You know,
for them to pay it out of pocket.
If you weren't showing enough improvement in some area,
and
they would drop that area.
Well, if you're paying for it out of pocket, I don't care. We'll continue to do it.
Yeah. You couldn't pay for it out of pocket at that time.
I don't know why you couldn't. I mean, yeah, if that's something we need to visit, absolutely. If somebody's willing just to pay for the service, it would be like anything else per, 15 minutes or 30 minutes or an hour. There's no I understand what you're talking about as far as with a patient that's on Medicare. They do have to meet specific goals, and if they're not meeting those goals, then they would no longer qualify. But if you're paying out of pocket, no, we would love that more so than a private pay. I mean, a private payer is obviously better than Medicare or Medicaid or any of them. So, yeah, we can talk about that if we need to. Okay. What else do you have?
I had to have blood work done a couple of weeks ago, and the doctor only ordered one Pacific blood test, and the Medicare would not pay for one Pacific blood test. But luckily I had Blue Cross and Blue Shield
that picked it up.
Well, they're seen.
Yeah.
But I did tell her, I said, if they don't pay it, send me the bill.
Right.
Is this something new with these Obamacare?
No, it depends on what test it was, and there are some tests that Medicare will not cover. And that's when you hear, when you register, that's when you'll hear the registration clerk say, this test may not be covered by Medicare. I need for you to sign this in case they don't cover it, and then you would be financially responsible. It gives you the option to say, well, hey, if they're not going to pay for it, then I don't want the test. Because legally, if we don't have you sign that, then we can't ask for payment. So that's what happened.
Well, anyway, I'll let the doctor know that when he orders a blood test again, that he needs to order several things in order for.
There you go. There's the efficiency of our government right there.
I don't know. My mother, she's in her 80s, and probably 3 years ago, Dr. Berry said, you know, it might be time for you to get a colonoscopy. Have you ever had one in your entire life? And Mom said, no, she didn't. But it was done over at St. Mary's, and then we had to rent. We had to go over there and check into a motel because, you know, you got to wake up real early in the morning for prepping. And she had it done over at St. Mary's. Dr. Rao did it. And, you know, she's on Medicare. I don't think she hardly had to pay anything. And then a couple years ago, well, last year, I turned 50. And I did it when you're supposed to do it. You know, when you turn 50, you're supposed to do it. And I did it up here. And, of course, I'm not on Medicare, but I'm still on Blue Cross and Blue Shield, but you know what? I had to pay for everything. I had to pay practically everybody, everything. It don't pay to do. If it's an emergency, yeah, you better go to the hospital. But I don't know. It's better to be on Medicare and then get your colonoscopy.
So wait to do your colonoscopy when you're on Medicare.
I don't know. It just really upset me because I figured, well, yeah, the anesthesiologists, yeah, they're almost impossible. You always got to pay for them out of your pocket. But then I had to pay Dr. Ransom, I had to pay you people, and like, and the envelopes just kept coming. Like, my God, we're never going to get caught up on this shit. I think I finally am, but I don't know. It kind of bums me out.
Yeah.
Medicare is hardly worth it. Don't get in a hurry for it.
All right. Any other questions for me? Concerns? All right. Very good.
Thank you.
And please, before I quit, I truly mean, I want, if you have issues, if you have care issues, if you have billing issues at the hospital, and you don't want to talk about them here, please come and see me. Please call me on the phone. We want to make this right. We want this to be your place that you seek care. We want to be known as your first option, not your last option. So please, I truly mean it. We work very hard to change the image of Share Medical Center. And if there's issues, going out on Facebook and spreading it, talking to your friends, that doesn't fix it, not unless I see it on Facebook. I want to know. I want to make things right. So please don't keep those things. Bring them to the person that can take care of it. So, all right. Thank you.
Okay, thank you very much. Thank you.